Hello everyone, welcome back to my channel. My name is Marion. In today's video, we have more questions for the Mammography Registry review. This is part 2. You can find part 1 at the end of the video. There will be a link on the screen for you to click. So in order to do well on your test, you must watch this entire video so that it can help you pass your registry exam. So I want to challenge you all to make it to the end. I would love to see if you all can do it. But you do have to watch the full video to like really benefit from it. All right, so this is a disclaimer I normally put on my videos just so that you all can understand what is the purpose of the video. It's pretty much to help you understand what you're weak at, what you're strong at. So I will just let you all read this. I normally read it to everyone, but I will just let you all pause the video and just read it because I still always get someone asking these questions. So I will let you all read this part. And then I do have my certification through ARRT. So it's broken down to patient care. There'll be about 20 questions. Image production, which is your physics, that will be 30 questions. Procedures, 65, which is going to also include your anatomy and positioning. With it will bring you to a total of 115 questions down here, plus those 30 unscored poly questions at the bottom. All right, so quick tips that I would like to give you all. Like I was saying, you do have to watch the entire video for this to help you. Um, all of my videos have pretty much helped a lot of people, so I think people benefit the most from it whenever they are watching it, and then you can always just rewatch it over and over. But I would say you just need to read the entire question and the answer choices. If you skip around, you may miss important information. If there is a question or a topic that I have not asked in this video, it's probably because I have already made it in another video. So these questions are all new. Just to give you all new material if you have seen my other videos. So like I was saying, I have over 30 mammo registry videos. I think this would make it 42. So if you don't see a question, I'm sure that I've already made that question, or I can make new ones. You just have to let me know in the comment box. So you can always pause the video, write down whatever question you stopped on, and just come back to it to finish the video if you cannot do it in one sitting. I know the video may get a little bit long, but just look at it as it's going to benefit you. I'd rather have a lot of questions in one video versus having 10 questions in this video, 5 questions in another video, and then I forget which questions I asked. So just easier to put a lot of questions in one video. I want to give a special shout out to Anna. She actually left me a message on YouTube and she asked me if I tutor, and I told her no because at the time I wasn't tutoring anyone, but she kind of like insisted on me tutoring her. So I tutored her for about 2 or 2.5 months. And the way my tutoring sessions was set up was I charged $25 per hour. So if you only needed 1 hour, then that's $25. If you needed 2 hours at one time, then that's $50. So with her, we did that weekly, one time weekly. And she did pass her test on the first try. She left me a big donation that I'm just grateful for. But however, I do not tutor anymore, and that was because after well, actually during the time before and after I was tutoring Anna, I had other people reach out to me through email, and they wanted me to tutor them as well for other modalities like MRI and CT. And they would give me a date, and they would just never show up. And the tutoring was done online. Like I like to do it through Zoom or through Teams. So the tutoring was done online, and they're booking appointments, and I'm losing out on money because I'm sitting around at the house thinking that I'm about to tutor someone. So I'm not working or anything. I'm taking off or telling people, no, I can't work this day because I'm trying to tutor people. And just keep in mind, it was only $25 that I was charging. So not really a lot of money to miss out on work pretty much. So shout out to her. I don't tutor anymore though because I just got tired of people saying that they was gonna do a tutoring session and then not attending. And then shout out to these ladies. They passed their registry. I'll just let you all pause the video. Also shout out to Miss Daphne. She sent me a donation. Shout out to these ladies. Thanks for Dashina sending me a donation. And then more shout outs, you all can just pause this to just read the shout outs, or actually them just telling me that they passed their test. They used my videos, and I don't know how long the ladies study for, but I appreciate everyone for watching my videos. More shout outs. Veronica, she left me a donation as well. And then I have more shout outs. So I do still have more shout outs or actually messages coming in saying, hey, I passed my registry. So I'm trying to respond to everyone and add them either to my video or shout them out on my page. But I'm starting to have a lot come in, which that's good because more people is finding my videos and passing their tests. And then these ladies, they was the first ones to let me know that they passed their test. So shout out to everyone. Congratulations for passing your test. All right, so if you are new to my video, what I like to do is I like to read the questions, the answer choices. I give you just a few seconds to think of the answer. So you can please pause the video or rewind it if I'm going too fast. Write down the question that you have gotten wrong so that you can just go back and just keep studying. The video is free, so you can just keep rewatching over and over. So I will say, if this is your first time watching my videos, if anything on the video bothers you, please either cover it up or please mute the video. Um, the way I have my videos made is just what I like to do. It makes me stand out from other content creators. It's gonna be some things that people like and don't like about my videos, and like I always say, I cannot please everyone. I'm just making these videos are for free. So if anything bothers you, I would say just cover it up with the sticky note. But other than that, let's get on to the video. Question 1. Which surgery is performed to remove the entire breast when a woman has a very high risk for breast cancer? A. Lumpectomy. B. Mastectomy. C. Prophylactic surgery. D. Sentinel node biopsy. All right, the correct answer is C. Prophylactic surgery. So this is used to remove the entire breast when a woman has a very high risk factor for breast cancer. For example, whenever women are diagnosed or have that BRCA1 or BRCA2 cancer gene. Question 2. All of the following minimizes focal spot blur except for A. Large focal spot. B. Large source to image receptor distance. C. Small focal spot. Or D. Small source to image receptor distance. All right, the correct answer is A. Large focal spot. So you want to use a small focal spot size, a large SID, and a small OID to minimize the focal spot blur. So if you need to pause it to just study the explanation, you can. I forgot to add If the audio bothers you, you can just always mute the video if that helps you study better. Question 3. The random disturbance that obscures or reduces image clarity is called A. Motion, B. Noise, C. Pixel, D. Resolution. All right, the correct answer is B. Noise. Image noise or quantum noise appears as a grainy, like salt and pepper on the image. Image noise is controlled by the milliamperage. If mass is increased, noise decreases. Once mass increases, patient radiation dose will increase. So just keep that in mind. If you are increasing your mass, the patient radiation dose is going to increase as well. And every now and then when I forget to say something that I forgot to add at the beginning of the video, I'll just mention it throughout. So the reason why I like to speak in my videos is number one, I make these videos on my own. So I just want, credit for what I'm doing. And then number two, I've had people tell me that they drive to work or drive home and they're listening to my videos because they have a long commute. So it helps them not have to, look at their phone or read a book or whatever because they have audio. So that's another reason why they can clean or they can, drive home and they can listen to me. Question 4. How many fibers, spec groups, and masses does the new American College of Radiology, ACR Phantom has now? A. 4 fibers, 6 spec groups, and 2 masses. B. 5 fibers, 5 spec groups, and 5 masses. C. 6 fibers, 4 spec groups, and 5 masses. Or D. 6 fibers, 6 spec groups, and 6 masses. All right, the correct answer is D, 6 fibers, 6 spec groups, and 6 masses. So with QC or quality control, this is performed to make sure that the mammogram images would not have any artifact on it. So sometimes you have clinics that does this like weekly. They try to pick the same day of each week to do this test. And if an artifact is found during QC, the tech is going to, let the manager know, let the physicist know so that they can come out, run their tests, make sure that artifacts is not showing up anymore. Because if this is shown on a regular mammogram when a patient comes in, this is going to look like a spot was found on the breast, which is going to increase unnecessary callbacks and maybe breast biopsies. So it's good to like really learn it and be trained on it so that you are catching those artifacts. Question 5. A 65-year-old female patient had surgery to remove a breast cancer tumor. The patient noticed swelling and pain several weeks after the surgery. Fluid was seen on the mammogram/breast ultrasound images around the surgical site. What is this patient's diagnosis? A. Ductal carcinoma in situ. B. Inflammatory breast cancer. C. Fibroadenoma. Or D. Seroma. And if you need to pause the video to reread the question, you can. All right, the correct answer is D. Seroma, which is a fluid that can be seen under the skin after a surgical procedure, such as your lumpectomy, your mastectomy, or if a lymph node was removed. All right, so if you are finding this video helpful, could you please like, share, and subscribe for more videos? Thank you all so much. All right, question 6. How many continuing education units or CEUs are required for mammography technologists? A, 15 CEUs every 36 months. B, 24 CEUs every 24 months. C, 30 CEUs every 10 months. Or D, 40 CEUs every 40 months. All right, the correct answer is A, 15 CEUs every 36 months. So I work in multiple modalities, and the way I do it is I try to just knock out 15 CEUs first, and I have it for mammography. And after that, I do my other CEUs that I have to get, like 14 or 10 more that I have to get in other modalities. Question 7. The U.S. Food and Drug Administration, or FDA, approves certifying states for a facility to perform mammograms except for A, state of Iowa, B, state of Louisiana, C, state of South Carolina, or D, state of Texas. All right, the correct answer is B, state of Louisiana. The FDA approved these certifying states: the state of Illinois, the state of Iowa, the state of South Carolina, and the state of Texas. Certification means that the U.S. Food and Drug Administration, or an approved state certification agency, has stated that these states are capable of providing high quality mammograms. Question 8. Which type of breast procedure removes the entire breast, lymph nodes, and chest wall muscles under the breast? A, lumpectomy. B, mastectomy. C, modified radical mastectomy. Or D, radical mastectomy. All right, the correct answer is D, radical mastectomy. Question 9. Which level does the breast extend vertically from the clavicle bone? A, first or second rib. B, second or third rib. C, third or fourth rib. D, fourth or fifth rib. All right, the correct answer is B, second or third rib. Question 10. Which level does the breast meet the abdominal wall? A, fourth or fifth rib. B, fifth or sixth rib. C, sixth or seventh rib. D, seventh or eighth rib. All right, the correct answer is C, sixth or seventh rib. So just make sure that you remember that the breast starts at the second or third rib to meet the abdominal wall at the sixth or seventh rib. Question 11. Which muscle is large, thick, fan-shaped, and is located immediately posterior to the breast tissue? A, latissimus dorsi muscle. B, pectoralis major muscle. C, pectoralis minor muscle. Or D, serratus anterior muscle. All right, the correct answer is B, pectoralis major muscle. Question 12. Which condition is shown for ductal carcinoma in situ cases that is detected on mammogram image? A, cyst. B, fibroadenoma, C, macro calcifications, or D, micro calcifications? All right, the correct answer is D, microcalcifications. So DCIS is a breast cancer that is confined to the duct and does not invade the duct walls. And sorry if I'm going too fast. Just trying to make sure that I'm not delaying it too much, but also not trying to go too fast and not trying to go too slow. So just bear with me. Question 13. Which program identifies issues with the mammogram images early in order to correct these errors before it can have a negative impact on the patient? A. Enhancing quality using the inspection program, which is EQUIP. B. Mammography Equipment Evaluation, your MEE. C. Mammography Quality Standards Act, which is your MQSA. Or D, medical audit? All right, the correct answer is A, enhancing quality using the inspection program EQUIP. Question 14. Which professional agency started the voluntary accreditation of mammography facilities? A, American College of Radiology, ACR. B, Centers for Disease Control and Prevention, CDC. C, Food and Drug Administration, FDA. Or D, the American Registry of Radiologic Technologists, ARRT? All right, the correct answer is A, American College of Radiology, ACR. ACR ensures that mammography facilities are performing high quality diagnostic mammogram images. So, if you all Well, you probably do not know, but if you are a tech and you're watching this for CQR purposes, so let me know in the comment box. Are you like watching the videos because you're trying to get your mammography registry for the first time, or do you have your mammo registry license and you're just watching this because you're studying for your CQR? Because when you get your license, you have to take like an assessment every 10 years. It's not pass or fail, but if you don't do well on it, you're going to be assigned like a lot of CEUs to take. So if you are already a mammotech, then you already know the process with ACR and having to submit images to them. But if you are not, whenever you start working, there's going to come a time where you're going to pretty much have to submit your best images over to ACR, and they go through a whole process. But that's what ACR is going to do. They're going to just make sure that you are performing high quality diagnostic images instead of just taking images and just turning in anything. Question 15. Which breast cancer is the most common and accounts for about 75 to 80% of all breast cancers? A. Invasive ductal carcinoma. B. Invasive lobular carcinoma. C. Medullary carcinoma. Or D. Papillary carcinoma? All right, the correct answer is A. Invasive ductal carcinoma. So this is whenever the breast cancer has started in the milk ducts, but it begins to spread to the surrounding tissues. So that's why it's called invasive. Question 16. This is a true or false question. So I'm not saying, sorry if I'm scratching a lot, I have eczema, so sometimes my skin get overheated, but I'm not saying that your registry will have a true and false question. This is just something that kind of to like help you all study a little bit more or study better so that you can retain the information in a different way. Breast augmentation is when the breast size is surgically reduced or made smaller. Is this true or false? All right, the answer is it's false. So, breast augmentation is when a patient has breast implants surgically placed or fat transferred to the breast tissue to enhance or increase the breast size. So, I wanted to put this question in just so you can understand what breast augmentation is because when I was a student or when I was, well, actually, I cross trained. So, I didn't go through like a program, I was cross trained. So, which is technically a student. So when I was cross training, that terminology always confused me. I always thought it was something else. So anyway, breast augmentation is whenever the breast size is increased. Question 17. Which breast cancer accounts for approximately 10% of all breast cancer and may have a spider web appearance or cause skin retraction? A. Invasive ductal carcinoma. B. Invasive lobular carcinoma. C. Medullary carcinoma. Or D. Papillary carcinoma. All right, the correct answer is B. Invasive lobular carcinoma, which is difficult to see on the mammogram images. So this type of cancer is very high in malpractice lawsuits if it's not properly diagnosed or detected. Question 18. The recommended dose when calculating patient radiation doses with mammography is A. Absorbed dose, B. Dose length product, C. Intraskin dose, or D. Glandular dose. All right, the correct answer is the glandular dose. The intraskin exposure, that's easy to measure, and this dose is for pretty much diagnostic x-ray. Same thing with absorbed dose. We use that in diagnostic x-ray. Dose length product is for computed tomography, also known as CT. So your answer is glandular dose. Question 19. Which of the following is considered the initial approval step required by all facilities in the United States before they can legally perform mammograms? A. Accreditation. B. Certification. C. Continuing education unit. Or D. Medical audit. All right, the correct answer is A. Accreditation. Question 20. All of the following accreditation bodies should be contacted in order for a facility to be accredited for mammograms except A. American College of Radiology, B. State of Arkansas, C. State of Florida, or D. State of Texas. All right, the correct answer is C, State of Florida. So for a facility to be accredited for mammograms, you must contact the American College of Radiology, the state of Arkansas, the state of Iowa, and the state of Texas. All right, so if you all would like to leave a comment, just let me know what state or what country you're watching from. This is just something fun I like to do. It just helps anyone, I guess, who is trying to move, see what jobs are available in other states. Is also just letting everyone know, hey, we still have people applying to mammography. So if you want to, just feel free to leave a comment. I just have a lot of people leaving a comment, letting me know where they're watching from. So I appreciate you all for commenting. So as you can see, I have people watching pretty much from everywhere, all over the US. I had one person watching from, I think, Saudi Arabia. So thank you all for watching my videos. I appreciate it. All right, question 21. Cancers of the breast that arises from fat, nerves, muscles, cartilage, blood vessels, or bone is called A. Lymphoma, B. Paget's disease, C. Sarcomas, or D. Tubular carcinoma. All right, the correct answer is C. Sarcomas, which is very rare, and these cancers account for less than 0.1% of all malignant breast cancers. Question 22. Which imaging modality uses gadolinium contrast when images of the breast is being performed? A. Breast MRI, B. Breast ultrasound, C. Computed tomography, D. Nuclear medicine. All right, the correct answer is A, breast MRI. So it's very important to know that breast MRI uses gadolinium based contrast or deuterium. So that's very important to know. Also, breast MRI scans are now recommended for patients with BRCA mutation, the gene mutations, and for patients that are high risk for breast cancer. Um, it can also be used for dense breast tissue as well as breast ultrasound scans. Question 23. Which position is useful in removing superimposed breast tissue? A. Craniocaudal, B. Exaggerated craniocaudal lateral, C. Medial lateral oblique, or D. Roll positions. All right, the correct answer is D, roll positions. So roll positions is helpful when removing superimposed tissue, especially when imaging dense breast lesions are rolled away from the dense breast tissue. So I forgot to mention if I'm clearing my throat a lot is because I'm getting over being sick. So I was like, since I'm not really sick anymore, let me get this video up for you all because I think I have some more people taking their tests at the end of this year, which is December of 2025. So this month I'm making this video is in December. I think it's December. Let me check. It's December 19th right now. So good luck on your test if you're taking your test soon. Question 24. The best definition for a pixel is A, an array of pixels in which each pixel is a sample of the image represented by numerical value. B, an unsharp shadow or blur surrounding the image. C, the ability to image two separate objects and visibly detect them as separate entities. Or D, the smallest component of the digital image. All right, the correct answer is D, the smallest component of the digital image. So a pixel is also known as a picture element as well. Question 25. Which of the following is the second leading cause of death amongst women in the United States? A, breast cancer, B, cervical cancer, C, ovarian cancer, or D, uterine cancer? All right, the correct answer is A, breast cancer. All right, so leave me a comment and let me know when you all are taking your mammography registry exam, or even if you're taking your mammo CQR assessment. I have a lot of videos on my channel. I know sometimes YouTube can be a little difficult to navigate, so I'll just link my all of my videos at the end for you to click on. So you'll click on it, it'll be on the screen, and it'll take you to all of my videos. Also, one of my videos I have how to get ready to pass your ARRT registry or get prepared to pass your mammo registry, something like that. And it gives you like a summary of what you all should know. It also gives you tips on how to pass. So you should check out that video. It's very helpful and I think you all can benefit from it. Question 26. The best time of the month to perform breast self-examinations for women with normal menstrual cycles are A, 1 week after the menstrual period ends, B, 1 week before the menstrual cycle is starting, C, on the first day of each month, or D, on the last day of each month. All right, the correct answer is A, 1 week after the menstrual period ends. A breast self-examination is an examination of the breast that is pretty much performed by the actual patient or yourself. So, the best time to perform these is 1 week after the menstrual period ends because our breast tissue is less tender and it's less painful to touch. Women that does not have regular menstrual cycles should perform their breast self-examination on the same day of each month. Question 27. A breast self-examination is performed to A, look for changes in the breast, B, look to see if a breast reduction is needed. C, look to see if breast implants are needed. D, to determine if you have gained weight by the size of your breast. All right, the correct answer is A, look for changes in the breast. So I think that was a pretty easy question, but sometimes I have people that watch my videos that have not even gotten into the program. So sometimes I like to throw in easy questions like this just for people who is just trying to see what they need to study or what type of study material they will have to do. Question 28. Which quadrant does approximately 75% of breast cancers occur in? A, lower inner quadrant, B, lower outer quadrant, C, upper inner quadrant, or D, upper outer quadrant? All right, the correct answer is D, upper outer quadrant. So, what I will say is not only should you know the answer, but pay attention to what the question is asking you and also the explanations because it say approximately 75%, um, whereas the breast cancers. So, if the question was reworded and asked approximately what percentage of cancers occur in the upper outer quadrant, would you have known approximately 75%? So just pay attention to pretty much everything, not just the answers. Question 29. The most common focal spot size in mammography for routine work is A, 0.1 millimeter, B, 0.15 millimeter, C, zero point 0.3 millimeter, or D, 2 millimeters. All right, the correct answer is C, zero point 0.3 millimeter. Question 30. What is the kilovoltage or kVp range that is used for most mammography units? A, 10 to 20 kVp, B, 20 to 40 kVp, C, 25 to 30 kVp, or D, 30 to 50 kVp? All right, the correct answer is B, 20 to 40 kVp. Question 31. Which target tube in mammography is a kilovoltage kVp range of 24 to 30 kV is used for? A, lead, B, molybdenum, C, rhodium, or D, tungsten? All right, the correct answer is B, molybdenum. Question 32. A kilovoltage range of 26 to 32 kV is used for which target tube? A, lead, B, molybdenum, C, rhodium, or D, tungsten? All right, the correct answer is C, rhodium. Question 33. Which of the following technique is used to collect cells from the lining of the milk duct? A, ductal lavage, B, ductography, C, nipple aspiration, or D, stereotactic? All right, the correct answer is A, ductal lavage. Question 34. A specimen radiograph is normally taken for A, breast cyst, B, fibroadenoma, C, macrocalcifications, D, microcalcifications. All right, the correct answer is D, microcalcifications. Question 35. Which modality would be best to perform a biopsy procedure for a palpable lesion? A, breast MRI guidance, B, breast ultrasound guidance, C, computed tomography guidance, or D, mammography guidance? All right, the correct answer is B, breast ultrasound guidance. So the reason why it would be breast ultrasound is because it keyword palpable, and palpable means something that you can feel. So it's just easy because I do breast ultrasound scans as well. I have my certification for it. So it's just easier to be able to feel that lump or something on the breast and to just use the probe to scan it as well. And then breast ultrasound is faster and it's cheaper. With microcalcifications, breast ultrasound will not be used for that because the microcalcification is going to cause like an artifact or a streak on the images. So that's why microcalcification is better performed under mammography. Question 36. Which procedure is performed to evaluate a suspicious nipple discharge? A, ductography, B, ductal lavage, C, mammoplasty, D, mastopexy? All right, the correct answer is A, ductography. Question 37. Which procedure is performed if a lesion is not palpable and can be seen on mammogram? A, core needle biopsy, B, fine needle aspiration biopsy, C, open surgical biopsy, or D, stereotactic localization? All right, the correct answer is D, stereotactic localization. Question 38. Which race has a higher chance of being diagnosed with breast cancer? A, African American women, B, Asian women, C, Caucasian women, D, Hispanic women. All right, the correct answer is C, Caucasian women. So, although Caucasian women may have a slighter or a slightly higher chance of being diagnosed with breast cancer when compared to another race, African American women are more likely to die from it due to lifestyle and seeking out medical treatment. So, as a healthcare professional, it is important to tell our family, friends, and loved ones to go in annually for their preventative exams or if they feel or sense anything abnormal. Question 39. Which organization does not recommend breast self examination and clinical breast examination at any age? A. American Cancer Society. B. American College of Obstetricians and Gynecologists. C. American College of Radiology. Or D. U.S. Preventive Services Task Force. All right, the correct answer is the U.S. Preventive Services Task Force. All right, so if you all are tired or exhausted at this point, go ahead and grab you some lunch, grab you a snack, and just come back to the computer and just snack away and keep listening. Or you can grab some coffee. I like to grab tea to drink. So you can grab something just so you can just relax, have some energy. So just go take a break and go grab you something to eat or drink. I know the video is, long, but hey, it's useful, it's free, it's something that you can just study with on the go. So I hope you all are enjoying the video. If so, could you please, if you find the video helpful, could you please give the video a thumbs up? Thumbing the video up or just leaving a comment is free. It's letting me know, hey, I appreciate your video. I appreciate your time for just making this. So anyway, if you all need to just pause and just stop at this time, then you can, but I'm going to just continue with the video. Question 40. Which organization recommends that screening mammograms should continue as long as a woman is in good health and expected to live 10 more years or longer? A. American Cancer Society. B. American College of Obstetricians and Gynecologists. C. American College of Radiology. Or D. U.S. Preventive Services Task Force. All right, the correct answer is A, American Cancer Society. Question 42. The recommended glandular dose by the American College of Radiology without a grid during a mammogram is A, zero point 0.1 rad, B, zero point 0.2 rad, C, zero point 0.3 rad, or D, zero point 0.5 rad. All right, so I'm going to give you the answer, but I want to tell you a different way to study. So you see how this question is asked, the recommended glandular dose by the American College of Radiology without a grid is. So if the question was asked in a different way and it say which organization recommends glandular dose without a grid during a mammogram, and it gives you a list of organizations, kind of like on the other slide I just did, then you know the answer would be the American College of Radiology. Or if you need to know the answer, just make sure you know it in rad. Make sure you know how the answer is in millirad or milligray or something like that. But the correct answer is a point 0.1 rad. Question 43. The ability to image two separate objects and visually distinguish one from the other is termed A. Contrast resolution, B. Pixel, C. Resolution, D. Voxel. All right, the correct answer is C. Resolution. Question 44. Which of the following can be voluntary or involuntary and is another factor affecting resolution and sharpness of the image? A. Motion, B. Noise, C. Pixel, D. Resolution. All right, the correct answer is A. Motion. So the reason why motion can be involuntary or voluntary is because, like with involuntary motion, that means the patient has, let's just say, Parkinson's disease. That's something that they cannot control whenever they're moving, unless they have medication that they have taken. And even so, some patients still may move a little bit. And then voluntary is whenever they're moving and they can control it, but maybe they're moving because um, maybe you have to provide the proper amount of compression, or maybe because you didn't give them the proper breathing instruction. So, the proper amount of compression and proper breathing instructions can reduce the patient motion, especially for people who have had a mammogram for the first time. I like to rehearse the breathing instructions with them so that they can know what to expect. Question 45. The ability to distinguish anatomical structures of similar subject contrasts is called A. Contrast resolution, B. Spatial resolution, C. Pixel, D. Voxel. All right, the correct answer is A. Contrast resolution. Question 46. The ability to image small objects that have a high subject contrast is called A. Contrast resolution, B. Spatial resolution, C. Pixel, D. Voxel. All right, the correct answer is B. Spatial resolution. And if you go back to that question for 46, the key word is small objects. So spatial resolution is great for fine detail or small objects. So just keep that in mind. Question 47. The biggest risk factor for developing breast cancer in women is A. Age, B. Dense breast tissue, C. Gender, being a female, D. Family history of breast cancer. All right, the correct answer is C, gender, being a female. Question 48. When should patients schedule their mammogram if they are still having menstrual cycles? A, 7 to 10 days after the start of their period. B, 7 to 10 days before the start of their period. C, 5 days before their period. D, 30 days after their period has ended. All right, the correct answer is A, 7 to 10 days after the start of their period. Question 49. When should patients receive their results after they have a mammogram? A, within 30 minutes. B, within 30 days. C, within 50 days. D, within 90 days. All right, the correct answer is B, within 30 days. So if there is a concern, this must be communicated with the patient within 5 days. So just keep that in mind. The only time they receive their results or um, the only time they receive their results like within 30 minutes to an hour is if they are like a diagnostic patient and they came in and they got like a workup done because something was seen on their screening mammogram. And before the patient leaves, the radiologist tell the patient if it's something good or if it's something where it needs to be biopsy. But other than that, if it's just a regular screening mammogram, then they will receive their results within 30 days unless there is a concern. Question 50. Which imaging modality is best for early breast cancer detection? A, breast ultrasound. B, computed tomography. C, magnetic resonance imaging, which is MRI. Or D, mammography. All right, I'm sure that's an easy question. The answer is D, mammography. All right, so if you made it this far to question 50, could you put a pink ribbon emoji in the comment box for me, please? It just gives me an idea like how far people have watched. So you're halfway there, and I do have a lot more questions coming up, so make sure that you keep watching the video because the questions get harder. Also, I highly suggest and encourage you all to watch my 100 practice review questions or something. It's for mock exam one. So you can find all of that in my playlist for mammography, which I will link it to the end. All of these questions are very different, so I highly suggest you watch it. Question 51. Which organization recommends that clinical breast examinations start at age 40 years? A. American Cancer Society. B. American College of Radiology. C. American College of Obstetricians and Gynecologists. And D. U.S. Preventive Services Task Force. All right, the correct answer is B. American College of Radiology. So you also need to know what the clinical breast examinations are for. That is whenever a qualified physician or your doctor does the breast exams on you versus you doing it on yourself. So make sure you know the difference between the clinical breast examination and the breast self-examination. Question 52. A single mammogram projection gives patients blank of radiation. A, 0.08 MSV. B, zero point 0.1 MSV. C, 1 MSV. Or D, 2 MSV. All right, the correct answer is C, 1 MSV. So when you're, like I was telling you all in the other slides, when you're looking at the answers, make sure that you know what the answer is in MSV and rem, so millirem. So just make sure that you know. Question 53. Which breast procedure removes the breast tissue and includes a removal of the nipple areola region? A. Lumpectomy. B. Mastectomy. C. The modified radical mastectomy. Or D. The radical mastectomy. All right, the correct answer is C. The modified radical mastectomy. I forgot to mention, put it in the comment box how you all are doing. Like, are you getting a lot of the questions right? Um, if you want to, you can even put your score. You can say, I missed 10 questions or I got 90 questions right. You can do that just so I can see how you all are doing. Because if you all are getting majority of them right, then that means that you all are studying, y'all are prepared, or I can make the questions a lot harder too. Question 54. The most breast conserving surgical option for the patient is called A. Chemotherapy, B. Lumpectomy, C. Mastectomy, D. Radiation therapy. All right, I'm about to give you all the answer, but breast conserving means something that's just going to pretty much pretty much save the breast or not take a big chunk out of the breast. So the answer is B, lumpectomy, because when you're doing the lumpectomy, um, if you have a breast this big, a lumpectomy is probably going to take like maybe like a dime, maybe like a dime or nickel size if the cancer is small out of the patient's breast, compared to a fist. Question 55. A surgical procedure to remove lymph nodes from the axilla while checking for breast cancer spread is called A. Axillary node dissection, B. Axillary node resection, C. Lymphedema, or D. Lumpectomy. Right, the correct answer is A. Axillary node dissection. Question 56. Nulliparity is a woman that A. A woman that has given birth at age 30. B. A woman that is breastfeeding. C. A woman that does not have breast nipples. D. Has never given birth to a viable baby. All right, the correct answer is D. Has never given birth to a viable baby. Question 57. Which display monitor has less screen glare and better resolution? A. Cathode ray tube. B. Flat screen monitor. C. Light emitting diode. D. Liquid crystal displays. Also, make sure that you all know the acronyms for the words as well, like the terms. The correct answer is D. Liquid crystal displays. You may hear this be called LCD. Question 58. Which procedure is done before a breast surgery when an abnormality is seen on a mammogram but is not felt by the patient or physician? A. Breast MRI guided biopsy. B. Fine needle aspiration biopsy. C. Lumpectomy. Or D. Preoperative needle localization. All right, the correct answer is D, preoperative needle localization. Question 59. A cyst aspiration is performed to A, diagnose breast cancer, B, prepare patients for a surgical procedure, C, relieve pain, D, remove the cyst completely and it never comes back. All right, the correct answer is C, relieve pain. So, breast cysts are painful, so aspirations are done to relieve the pain and to remove some of the fluid or as much fluid possible from that cyst. Even though the cyst is going to like decrease in size, um, it doesn't completely go away and never comes back. Hopefully, it stays away, but I know some people they get cysts and sometimes it just comes back. So it doesn't completely remove the cyst. It may or it may not grow back. Question 60. How many projections should there be a nipple in profile on the mammogram images? A, 1, B, 2, C, 3, D, 4. All right, the correct answer is 1. So there should be at least one image where there's a nipple in profile out of the 4 projections. So if you're doing a right breast, which is normally 2 projections, standard to do 2 projections on each breast. So on that right breast, you must have a nipple in profile on at least one image. Of course, if you get it on both images, on the right breast and left breast, that shows that you have great positioning. But if you can't due to body habits or how patient was able to tolerate the positioning, sometimes you do have to do those courtesy nipple and profile pictures, but it is required that you have at least one image on the right breast and at least one image on the left breast where there is a nipple in profile. All right, so feel free to leave a comment whenever you all get your mammo certification. What setting do you think you may want to work in? Hospital setting or outpatient imaging clinic setting? So I have worked mainly in the hospital as a mammotech, but when I worked in other modality in the outpatient imaging clinic, I was able to look at the mammotech schedule and see how many exams was performed. So from my experience at the places that I've worked, at the outpatient imaging clinic, there was only one tech. So they would have anywhere from 30 to 40 um, patients on their schedule. And keep in mind, this all depends on if you're working an 8-hour shift, 10-hour shift, or 12-hour shift. So, of course, the longer your work hours as a mammotech at the outpatient clinic, the more patients they're going to put on your schedule. At the hospital, you normally have at least 3 or 4 other techs working with you, and this all depends on how big or small your hospital is. So although there may be more work, there are more techs to kind of like distribute the work throughout. So just put in a comment box which setting you want to work in or is already working in as a mammo tech. Question 61. Which term is used for a pregnancy that is carried to the point of at least 20 weeks of gestation? A. Multiparity. B. Nulliparous. C. Parity. D. Primiparity. All right, the correct answer is C. Parity. Question 62. Male patients account for approximately blank percentage of all breast cancers. A, 1%, B, 25%, C, 50%, D, 75%. All right, the correct answer is A, 1%. So comment down below if you have taken a mammogram on a male patient or have observed how it is done. When I was a brand new mammotech, I used to be so nervous with taking images on male patients because I thought it was going to be difficult, but it's really not. Like if the male comes in and they don't have a lot of hair on their chest, it's very easy. But when I say hair, it's because if they're hairy on their chest, then sometimes their chest or breast tissue will slip away from the mammo compression powder and detector. So that makes it a little bit challenging. But other than that, it's pretty easy. Don't be scared. But I will say this. Do not make the mistake that I made and give a male patient a robe. I accidentally did that because you're used to taking mammograms on women. So I gave a male patient a robe, and don't do that, please. Just bring them to the mammo room when you're ready for them, and just have them take their shirt off. Most of them just want to take their shirt off. So learn from me. Question 63. An enlargement of the male breast due to growth of the ducts and supporting tissues is called A. Ductal carcinoma, B. Gynecomastia, C. Fibroadenoma, D. Hamartoma. All right, the correct answer is B. Gynecomastia, which can be caused by certain drugs or medications or health problems such as Klinefelter syndrome, estrogen, liver cancer, lung cancer, testicle tumors, kidney disease, etc. I'm just naming a few. So this is not all. You can refer back to your notes that your college or your program giving you, but this is just to name a few. Also, I made a video on male patients. I highly suggest you check it out because you just never know what questions you may be asked on your registry. Question 64. Which of the following is a major risk factor for breast cancer in male patients? A. Age, B. Gender, C. Klinefelter syndrome, D. Smoking. All right, the correct answer is A. Age. So age is a major risk factor for breast cancer in men, and gender is a major risk factor for breast cancer in women. So keep those two in mind. Klinefelter syndrome would be a risk for gynecomastia in male patients, and smoking would be a minor risk factor because that's something that we can control. You can control or hopefully control if you want to smoke or not. Question 65. Which of the following is a primary treatment for breast cancer in male patients? A. Chemotherapy, B. Latissimus dorsi muscle, C. Radical mastectomy, D. Radiation therapy. All right, the correct answer is C. Radical mastectomy. So they pretty much just do a mastectomy of the male patient's breast. Question 66. How many lymph nodes are found in the axillary or axillary region? A. 5 to 10 lymph nodes, B. 10 to 15 lymph nodes, C. 20 to 30 lymph nodes, D, 40 to 50 lymph nodes. All right, the correct answer is C, 20 to 30 lymph nodes. Question 67. The outer quadrant of the breast that extends towards the axilla is called A, lobule, B, pectoralis major muscle, C, tail of Spence, D, terminal ductal lobular unit. All right, the correct answer is C, tail of Spence. Question 68. A BI-RADS score of 0 will indicate A, benign non-cancerous finding, B, highly suggestive of malignancy, appropriate action should be taken, C, incomplete, additional imaging evaluation and/or comparison to prior mammograms or other imaging tests is needed, D, negative. All right, the correct answer is C, incomplete, additional imaging evaluation and/or comparison to prior mammograms or other imaging tests is needed. So if you all, I do have a few more BI-RADS questions in this video, but I did make a full video with practice test questions and answers, several scenario questions with the BI-RADS score. So like I was saying, click on the playlist link at the end of the video to get to it. I think it's labeled 20 BI-RADS score must know questions or something like that, but I have a lot of BI-RADS score questions in that video. Question 69. A patient's mammogram results indicate a report that states probably benign finding. Patients should follow up in a short time frame. Which BI-RADS score is this considered to be? A, 0, B, 1, C, 2, D, 3. All right, the correct answer is D, 3. Question 70. An enlarged lymph node that is greater than blank centimeters should be considered suspicious. A, zero point 0.5 centimeters, B, 1 centimeter, C, 2 centimeters, or D, 3 centimeters. All right, the correct answer is D, 3 centimeters. So a benign lymph node measures approximately less than 2 centimeters. Question 71. Which of the following is a tumor that can develop on the skin and has been linked to excessive exposure to ultraviolet light, especially sunlight? A, lymphoma, B, melanoma, C, sebaceous cyst, or D, skin tags? And skin tags is those little mole looking things that is on patients' breast. Sometimes they're raised and they look like they're falling off or flat. So that's what a skin tag is. All right, the correct answer is B, melanoma. Question 72. Which breast cancer is often referred to as stage 0 carcinoma? A, carcinoma in situ, B, invasive ductal carcinoma, C, invasive lobular carcinoma, D, medullary breast carcinoma. All right, the correct answer is A, carcinoma in situ. So carcinoma in situ is a breast cancer that has not spread past the original site where the breast cancer has started. This type of cancer is a non-invasive breast cancer. Question 73. Which of the following is considered a benign milk-filled cyst with a high fat content? A. Fibroadenoma. B. Galactocele. C. Intraductal papilloma. Or D. Phyllodes tumor. All right, the correct answer is B. Galactocele. And if you're wondering why a lot of my questions do not have explanations, that's because I have 3 videos that's 1 hour long where I've gone into further detail and broken down all of this information. So I highly recommend you all check those out. It's like lesson review videos, and it's like an hour long for all 3. It covers patient care, physics, and anatomy. Question 74. An oval lesion that may contain calcification is called A. Fibroadenoma, B. Intraductal papilloma, C. Lipoma, D. Phyllodes tumor. All right, the correct answer is A. Fibroadenoma. Question 75. Which breast condition can occur in the lactating breast and can present as a red, hot, and painful mass? A. Abscess. B. Cyst. C. Hemangioma. D. Hematoma. All right, the correct answer is A. Abscess. Question 76. Which BI-RADS score means a known biopsy proven malignancy result? A. 3, B. 4, C. 5, D. 6. All right, the correct answer is D. 6. So I think the BI-RADS scores start getting tricky for most people when it's kind of hard for them to know the difference. It's at about 3 to 6. So if you're one of those ones where you know BI-RADS score is 0, 1, and 2, make sure that you're like really studying the difference between BI-RADS score 3, 4, 5, and 6. Question 77. A patient's mammogram result states that there is an oval circumscribed breast tumor that was found on the right breast at 3 o'clock. Which diagnosis would this be considered? A. Adenosis. B. Fibroadenoma. C. Hyperplasia. Or D. Intraductal papilloma. All right, the correct answer is B. Fibroadenoma. Question 78. Which imaging modality is best for visualizing a circular or oval lesion? A. Breast ultrasound. B. Computed tomography. C. Mammography. D. Magnetic resonance imaging. All right, the correct answer is A. Breast ultrasound. Question 79. Which percentage of women that has developed breast cancer does not have a first degree relative with breast cancer? A. 25%, B. 50%, C. 75%, D. 90%. And all of these percentages is approximately. I have to throw that out there because with numbers and research, it's always changing, especially in medical. So approximately which percentage? All right, the correct answer is D, 90%. So a first relative family member would be considered like your mom, a sister, or a child, which, could be a daughter. Question 80. Dense breast tissue is higher in, choose the best answer. A, older men in their 70s. B, older women in their 70s. C, younger men in their 40s. D, younger women in their 40s. All right, the correct answer is D, younger women in their 40s. Question 81. Which medication was for osteoporosis treatment in postmenopausal women, but is now used to treat invasive breast cancer in postmenopausal women? A, chemotherapy. B, radiation therapy. C, relaxafene. D, tamoxifen. All right, the correct answer is C, relaxafene. Question 82. Which surgical procedure involves removing the muscle, fat, and skin from the upper back? A, latissimus dorsi flap. B, lumpectomy. C, mastectomy. D, transverse rectus abdominis muscle or tram flap. All right, the correct answer is A, latissimus dorsi flap. Question 83. How many orifices or collecting ducts does the nipple have? A, 1 to 5 orifices. B, 5 to 10 orifices. C, 15 to 20 orifices. D, 20 to 25 orifices. All right, the correct answer is C, 15 to 20 orifices. Question 84. Approximately how many lobes does each breast have? A, 1 to 5 lobes. B, 5 to 10 lobes. C, 15 to 20 lobes. D, 20 to 25 lobes. All right, the correct answer is C, 15 to 20 lobes. Question 85. Gynecomastia in men is caused by all of the following except for A, cancer of the testes. B, cirrhosis of the liver. C, Klinefelter syndrome. D, progesterone. All right, the correct answer is D, progesterone. So, an imbalance of estrogen and testosterone will cause gynecomastia, not progesterone. So, in addition, cancer of the testes, cirrhosis of the liver, and Klinefelter syndrome will cause gynecomastia in men. And of course, it's more things and more medications, but I'm just naming a few. Question 86. The part of the X-ray tube that consists of a filament and focusing cup is called A, the anode. B, the cathode. C, the rotor. D, the timing circuit. All right, the correct answer is B, the cathode, which is something you may or may not remember from X-ray physics? Question 87. Which of the following is not considered one of the target material that is used in a mammography equipment? A. Lead. B. Molybdenum. C. Rhodium. Or D. Tungsten? All right, the correct answer is A. Lead. So the target material in mammography is molybdenum, rhodium, and tungsten. Question 88. Which target material is a kilovoltage kVp range of 23 to 35 kV used for in mammography? A. Lead. B. Molybdenum. C. Rhodium. D. Tungsten. All right, the correct answer is D. Tungsten. Question 89. The primary goal of breast compression in mammography is A. To increase patient dose. B. To increase KVP. C. To reduce breast thickness uniformly. Or D. To reduce the spatial resolution. All right, the correct answer is C. To reduce breast thickness uniformly. Question 90. We're almost done. So if you all made it this far and watched all of the video up until this point, I have a great feeling like you all is going to do well on your test, especially if you watch my other videos, because you have made it far. The maximum force of the breast compression should not exceed A. 15 pounds, B. 25 pounds, C. 30 pounds, D. 45 pounds. All right, the correct answer is D. 45 pounds. Question 91. All of the following are reasons for why grids are used in mammography except for A. Decreased scattered radiation. B. Improved contrast. C. Results in more radiation dose to the patient. D. Reduced patient radiation dose. All right, the correct answer is B. Reduced patient radiation dose. So grids actually increase patient radiation dose, but it does decrease scatter radiation, it improves contrast, and it results in more radiation dose to the patient, like I was saying. Question 92. The ratio for grids in mammography is approximately A. 2 to 1, B. 4 to 1, C. 7 to 1, D. 8 to 1. All right, the correct answer is B. 4 to 1. Question 93. The distance from the X-ray source to the imaging plate is called A. Grid height, B. Grid ratio, C. Object to image receptor distance, D. Source to image receptor distance. All right, the correct answer is D. Source to image receptor distance. Question 94. What is the recommended source to image receptor distance range that is used in mammography? A. 25 to 50 centimeters, B. 50 to 80 centimeters, C. 55 to 70 centimeters, D. 90 to 120 centimeters. All right, the correct answer is B, 50 to 80 centimeters. And if you look on the mammogram machine that you're working on or training on, if you look way up high, um, above the compression plate, like the very top of the machine, you'll see like some small numbers and it'll tell you what your SID is. Question 95. Which of the following is the part of the X-ray tube that is considered the positive side and receives the electrons emitted by the filament? A, the anode, B, the cathode, C, the rotor, D, the timing circuit. All right, the correct answer is A, the anode, which is something you may remember from X-ray physics. Question 96. One of the main reasons for not using a grid in mammography when magnification is required is because A, the grid decreases the milliampere seconds. B, the grid increases the radiation dose to the patient. C, the grid increases the kilovoltage peak. Or D, the grid reduces the radiation dose to the patient. All right, the correct answer is B, the grid increases the radiation dose to the patient. Question 97. A 45-year-old female patient was recently diagnosed with a right breast tumor that is less than 2 centimeters in size. There's no lymph node involvement or metastasis to any other body part. What is her breast cancer stage? A, stage 0, B, stage 1, C, stage 2, D, stage 3. All right, the correct answer is B, stage 1. Question 98. Which treatment uses drugs to treat cancer that may have spread beyond the breast? A, chemotherapy, B, hormone replacement therapy, C, mastectomy, D, radiation therapy. All right, the correct answer is A, chemotherapy. So, chemotherapy is pretty much whenever the cancer has spread to other areas, and just think of it as it's getting out of control. Chemotherapy is going to help like control that or hopefully get rid of it or shrink it. But radiation therapy is pretty much going to target like that small area of the breast. But when it has gone crazy, then it's going to be like chemotherapy. Question 99. A 75-year-old female patient had breast surgery to remove a breast cancer. The surgeon removed tissue from the lower abdomen to reconstruct her breast. Which type of surgery did this patient have? A, latissimus dorsi flap, B, lumpectomy, C, saline breast implants, D, tram flap. All right, the correct answer is D, tram flap. So a transverse rectus abdominis muscle is called the tram flap surgery. It involves the surgeon using blood vessels, fat, skin, and muscle from the lower abdominal wall to form a new breast tissue. For the latissimus dorsi flap, think of your back. Question 100. Which percentage of glandular and adipose tissue does the 4.2 centimeter thick compressed breast phantom has? A, 25% glandular, 75% adipose. B, 40% glandular, 60% adipose. C, 50% glandular, 50% adipose, or D, 90% glandular, 10% adipose? All right, the correct answer is C, 50% glandular, 50% adipose. All right, so you all have made it to at least question 100. I do have 15 more questions to go. So if you made it this far, could you please put a red emoji or a pink heart emoji in the comment box? This just letting me know that you all at least made it to 100. So the first mock video that I have, well, actually, I have another one. I think it's for 50 questions. But my other mock video that I have is for like 100 questions. So I wanted to make more questions in this video so that you all didn't get confused thinking that this was the same questions as the other 100 videos. So all of these questions are new, it's different. So be sure to check out this video, watch it all the way. If you skipped around, make sure that you go back and watch all of it, and then also watch the 100 questions part 1 video because it's all new questions. So good job for at least making it to this level. All right, question 101. Which cancer stage would ductal carcinoma in situ, or DCIS, be considered? A, stage 0, B, stage 1, C, stage 2, or D, stage 3? All right, the correct answer would be A, stage 0. So DCIS is stage 0 because it has not spread outside of the breast tissue. Question 102. Which breast cancer stage consists of a tumor size between 2 centimeters and 5 centimeters with lymph nodes being involved? A, stage 1, B, stage 2A, C, stage 2B, or D, stage 3A? All right, the correct answer is C, stage 2B. Question 103. Which breast cancer stage involves the cancer spreading to the lymph nodes and to the brain? A, stage 2A, B, stage 3A, C, stage 3B, D, stage 4. All right, the correct answer is D, stage 4. Question 103. Which breast cancer stage consists of a tumor larger than 5 centimeters with no lymph node involvement? A, stage 2A, B, stage 2B, C, stage 3B, or D, stage 3C? All right, the correct answer is B, stage 2B. Question 104. Which breast quadrant would a 2.5 centimeter oval mass be located in if the tumor was found on the right breast at 2 o'clock? A, lower inner quadrant, B, lower outer quadrant, C, upper inner quadrant, or D, upper outer quadrant? So this is when it becomes tricky, and this is where you're going to have to be at the testing site, grabbing your fingers or hand and feeling around on your breast. I had to do that. Another lady told me that she did that. So I don't think they're going to tell you you can't do that, but this is going to have to be a way for you to remember which quadrant. So I will give you a few moments to think about the answer. All right, the correct answer is C, upper inner quadrant. So as you can see, if you're looking at the right breast, you're going to have to know which breast is 12 o'clock. So give me 1 second. So right breast, this would be 12. This would be 1, 2. So as you can see, 2 o'clock is still falling in the upper outer quadrant. This would be 3. So that's going to be how you kind of have to answer these questions. Question 105. Which breast quadrant would a 3 centimeter spiculated mass be located in if the tumor was found on the left breast at 4 o'clock? A, lower inner quadrant. B, lower outer quadrant. C, upper inner quadrant. D, upper outer quadrant. All right. So I'm giving you all a little bit longer for these type of questions because I know you all like have to fill around. So the correct answer is B, lower outer quadrant. So we'll take the left breast, and this would be 12, 1, 2, 3, 4. So you can see that that falls in the lower outer quadrant. And I was gonna do 5 and 6, but I don't want to confuse you all. All right, question 106. Which breast quadrant would a 6 centimeter fixed mass be located in if the tumor was found on the left breast at 8 o'clock? A, lower inner quadrant. B, lower outer quadrant. C, upper inner quadrant. D, upper outer quadrant. All right, the correct answer is A, lower inner quadrant. So if you do need to pause the video to give yourself time to think, you can. So the way I'm drawing on these on the diagram, that's pretty much how you're gonna do it on your with your fingers for your breast. So it's say left breast at 8 o'clock. So this will be 12, 1, 2, 3, 4, 5, 6, 7, 8. So that's why it's going to be A, lower inner quadrant. Question 107. A patient is having pain in her right breast at 11 o'clock. Which breast quadrant would this be located in? A, lower inner quadrant. B, lower outer quadrant. C, upper inner quadrant. Or D, upper outer quadrant. So once again, you can't memorize these answers. You have to know based off of how you're feeling on each breast, which quadrant would this side fall in versus the middle. You have to know for each breast and be able to just point on your own breast with these numbers and scenarios. So the correct answer is, we'll do it together, D, upper outer quadrant. So it's say pain in the right breast at 11 o'clock. So this will be 12, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, which is falling in the upper outer quadrant. All right. Question 108. Which of the following is a major risk factor for breast cancer? A. Aging. B. Alcohol consumption. C. Early menarche, which is having first period before age 12. Or D. Having a first child after age 30 years old. All right, the correct answer is A. Aging. Question 109. Which of the following is a minor risk factor for breast cancer? So you'll choose two. A. Aging. B. Dense breast tissue. C. Family history of breast cancer. D. Late menopause. Or E. Never have given birth. So choose two of the following. All right, the correct answer is D. Late menopause, and E. Never have given birth. So aging, disc breast tissue, and a family history of breast cancer will be considered a major risk factor for breast cancer. Question 110. So we're almost done. We have 5 more questions to go. Which BI-RADS score would indicate a suspicious abnormality a biopsy should be considered? A2, B3, C4, or D5? All right, the correct answer is C4. Question 111. A BI-RADS score 2 will indicate A benign non-cancerous finding, B negative, this is a normal test result, C probably benign finding, short time follow-up, D suspicious abnormality, a biopsy is suggested. All right, the correct answer is a benign non-cancerous finding. Question 112. Why is magnification used in mammography? A. Decrease patient radiation dose. B. Reduce patient radiation dose. C. To assess large lesions or macro calcification. D. To assess small lesions or micro calcifications. All right, the correct answer is D. To access small lesions or microcalcifications. Question 113. The distance of the object or body part from the image plate is termed A. Grid height, B. Grid ratio, C. Object to image receptor distance, or D. Source to image receptor distance. All right, the correct answer is C. Object to image receptor distance. Question 114. Which of the following analyzes pre-reads the mammogram images and report any suspicious findings? A. 2D mammogram, B. 3D tomosynthesis, C. Computer aided detection, or D. Spatial resolution. All right, the correct answer is C. Computer aided detection, which is your CAD. Question 115. So this is the last question. Which treatment is used to relieve or alleviate the pain or symptoms of a disease without actually curing the disease? A. Chemotherapy, B. Mastectomy, C, palliative treatment, or D, radiation therapy? All right, the correct answer is C, palliative treatment. All right, so that's it. I hope you all enjoyed the video. If you did, could you please give the video a thumbs up? Leave a comment down below if you found the video helpful. I know I have a glare. I just called it. Um, but like I was saying, the video I know is long, but if you watch it all the way through, it's going to help you find out what you're weaker in, what you're stronger in, what you need to study more on, what you need to study less on. So, no, of course, you have to watch other videos. You can't just watch this video and say, um, this not enough because I have more videos in my playlist for you all to watch. So it's going to help because I'm sure someone is going to watch this video and they probably skip around and they missing the key points that I mentioned in the video about how you have to watch my other videos. So of course, this video, it has 115 questions. So there's going to be some questions that I have not asked in this video. And that's because I've already asked in other videos. Like I've already broken down the weekly QA and QC requirements. That's in other videos. I have a full video discussing BIRAS. And I have other videos discussing malignancy and breast cancers, um, anatomy. So just watch other videos that I have. Also, don't be afraid to leave a comment if there is more videos that you want me to make. Because shout out to this lady who requested for me to add staging to my questions because I think I had the staging in like a lesson review, but I didn't have a lot of questions on staging, like breast cancer staging, like stage 0, stage 1, stage 2, stage 3, stage 4. So she left a comment and she was like, hey, as I was studying, I noticed that you didn't have or don't have many questions on staging. Can you make questions on staging? So that's why I threw in some questions on staging because I was thinking, I realized maybe I didn't have a lot of questions on staging. So anyway, like I was saying, like the saying goes, how you eat an elephant, one bite size at a time. So that's how you have to pretty much approach this video. Just break it down, take breaks, come back, pick off where you left off at. I'm curious to know how many questions that you get wrong, how many questions did you get right. Also, like I was saying, leave a comment. Just let me know when you're taking your test. I try to get this video out before the year ended, because I know I had some people tell me that they was taking their test in um, the end of this month, which is December 2025. I'm recording this in December 2025. I think it's December 20th now because I did some of it on December 19th, some of it on December 20th. So that's why I said you don't have to watch it in one sitting. If you can, that's great. Good for you. You knocked it out. And then also, um, you can come back and rewatch this video over and over and over again. Um, but other than that, if you think of anything that I have not asked in all of my videos combined, you can just leave a leave a post for me, and I can try to make new videos or whatever, like the other lady did, because I didn't realize I didn't have many questions on staging. I do, but you just have to find them in the other videos that I've made because I think with the mock videos, it really tests your knowledge. Like you kind of, it gets you out of the order of memorizing and it really tests your knowledge for that you to understand and know things. But other than that, thank you all for watching. Leave a comment if this video helped you. And also, if it did, could you please share it to other people so that it can help them? Because I don't have Facebook, Twitter, or X, whatever they're calling it now, Instagram, TikTok. I don't have any of those. So I can't share these videos to those platforms for other people to see and for it to help them. So anyway, thank you all for watching. Thank you all for sticking out with me this long, and I hope you all enjoy the video. Bye. Good luck. I will see you all in the next video.